people that have been interested in what we're doing?
No.
But, you know, due to open meetings, they get to have the choice if they so choose.
People that have been interested in what we're doing?
No.
No,
Let's see here. Okay. Just need one more. Hope we can get it here. There's Dr. Cannon, but she can't count for the quorum, but glad she's joined us. Hello.
Hi.
We're waiting on one more for a quorum, so
Okay.
just kind of hanging out.
is there anybody you can call, Stacy, or?
Yes, Judge Anderson said yes, he can get on. I'll send him the link again real quick.
Okay, is James on now?
Might be Whitney.
Whitney?
Whitney's on. Yeah.
Okay, so we have a quorum, Stacy?
Yes, we do.
Okay, we'll call to order the Board of Health meeting. Thank you all for getting on. Obviously, due to the COVID numbers, we're doing it via Zoom. Does everybody have a copy of the minutes from the May 18th meeting?
Yes.
Had a chance to look at those? Does anybody have any questions, comments? Anything about those? Okay, I'll entertain a motion to approve them.
Make a motion.
Second. Can somebody second? Laura, you're muted, Laura. Which is okay. Okay, so we have a motion and a second. All in favor to approve the minutes of previous meetings, say aye. Aye. Opposed? Okay, motion passes. Old business, we don't have any, Stacy?
Nope.
Okay, new business, introduction of the new nurse. Stacy?
Yes, I just wanted to introduce everybody to Robin Stangerone. She is here with us tonight on Zoom, and she is our new full-time clinic nurse. So I just want everybody to put a face with the name. And she took Judy Collins' place. If you remember her coming to meetings before, it was the same role. Judy transferred to another health department. So we have Robin, and we're happy to have her with us. And she's in a lot of training. Her brain is probably about to explode right now.
I can't think of I can't think of anything simple even. It's all real complicated.
She
You-
has over 20 years experience as a nurse, and she's doing a great job. So we're happy to have her.
Thank you. I'm happy to be here.
Okay. COVID-19 update, Stacy?
Okay, I'm gonna share my screen and kind of show some charts that will help summarize everything. Okay, can you guys see that?
Yes.
Yes.
Okay, I'm gonna try to go from beginning. How about that? Is that still good?
Yes.
Okay, so this is a representation of our cases by week through the whole pandemic. And you can see, we thought our high period was going to be November last year when we hit 133 cases in a week. And then with the Delta variant, you know, this chart really looks very similar to the state. If you followed along at any of the governor's press conferences, it follows the same pattern. And you can definitely see that when the Delta variant hit, and we just hit that trend straight up, and we've hit 167. And then I thought it was going down, as you can see, and then last week we had 162. So at least we've stopped the straight up trend, but we're kind of still hovering in that really, really high area, and just hoping that it'll drop off just as fast as it came. So the next slide is similar. It's the same numbers, but just in a little different format. And I put the red line straight across just so you can see where the red zone is at for us. So anything over the red, we hit the red zone. So you can see how far above that we are. It takes about 22 cases a week for us, and that's based on population. So it's going to be different for every county. But for us, you know, we had a great summer, as you can see there. We thought we really had come through it, but this variant has really been very highly contagious and kind of spread like wildfire here. So just want to show a couple of those charts. This is the vaccine dashboard on the state website you can go to. If you go to the Team Kentucky COVID-19 website, you can click and look at any county. So I actually zoomed in a little bit for you here so you can see, but with our county population listed there, it's showing 6,366 people vaccinated, which is 51.51% of our total population. And then it's broken down into those over 18 and then those over 65. So we've done really well with those over 65, about 90%. So that's great. But actually, you know, with this Delta variant, we're seeing a lot of more severe illness in younger people, a lot more hospitalization and death of younger people. So, but I was saying before the meeting started, you know, our vaccination rates have really picked up a lot with this latest wave. I guess if you could have one positive thing, you know, to come out of it, it would be that we've seen a lot more people make that decision to be vaccinated. So we've really picked up, and Robin can attest that we have trouble keeping vaccine. You know, we're really trying to stay on top of our stock because we can go through a lot more vials in a day than what we had been. So we're able to get Pfizer here now, which we hadn't been able to for a while, but they, you know, with science, the more they learn, and, you know, they've said it can now be in a refrigerator for 30 days when it used to just be ultra cold temps and that was it. So we're able to get Pfizer, and we try to just get the amount we think we can work with in 30 days. And the good thing, it's been a good problem to have, is we usually end up going through it a lot faster than 30 days and getting more. So this is a breakdown by age, if you would like to see, you know, of those 6,000 people, where they lie as far as age. So we've gotten 35% of our 12 to 17-year-olds. So, you know, that you can kind of see the trend. The older you get there, the more vaccinated. Of course, also when it came out, we kind of went that way as far as the older people were eligible first. And then the 12 to 17 haven't really been eligible that long. And I think there's been a lot more, you know, with parents waiting to see type of thing. But we're hearing that the 5 to 11-year-olds will be next, hopefully next month. So we'll be adding another age group to that. And then I went through and clicked around different counties around us and kind of did compiled it here for you just to see where we rank. I mean, our rates are really high according to our population right now. We're really high in the state, and we're actually really high in the nation, but our vaccine rates are not too bad. So hopefully that will help us get out of this and not have as much severe disease anyway, even if we're having some more breakthrough cases. So then also on the COVID update, I just thought I'd share a picture. You probably saw it in the paper or on Facebook, but we did have the governor visit last month for Healthcare Heroes Week, and we were really excited about that. Just a little pick me up, and you know, it was nice to have him and Rocky Atkins came too, and they were here in town for other business, but it was nice to be recognized and talk with him about the pandemic and just you know, how much he supported public health. And so I thought I'd share that again too. That's all I have. Anybody have any questions on that?
Okay, next on the agenda is financial statements.
Okay. So I'll share, this is in your packet, but thought I would go ahead and share this too. So normally our budget is in this column. There's zeros there, but it takes a while to get the budget fully approved through the state, which it actually has been as of yesterday. So our September reports should start showing our budget, and we'll be able to track better where we are with our budget. But a lot of our money right now, you know, we have to spend it first and then they'll give it to us. So like with our COVID money, we have certain cost centers that we will charge it to, and then they look at those reports and give it back to us. So we've spent a little more, you know, than we brought in, but that's just kind of the way it goes with our money. We have to spend it and earn it first, and then they'll reimburse. So we have year to date for this fiscal year, $140,654.62 in revenue. And then our expenses were $199,122.88. So about 58,000 different there, excess expense over revenue, but just have to keep putting those reimbursement reports out there and getting it back. So hopefully, it's really been a big help to have that money from the state. We've been able to hire 2 people and recently a part-time person too. So that's been really nice. Otherwise, our small staff, probably couldn't handle that. So.
And you have a clerk position. She's retiring, correct?
Yes, Kathy Hughes is retiring. She has over 27 years. It may be more like 28 or 29, but she's going to retire at the end of October. So I just advertised for that position. I'll be interviewing probably this week or next for that.
Okay.
Also, the taxing district, is that scrolling through for you all to see? No.
No.
Well, it's in your packet. The taxing district shows where we've taken our first payout of $225,000 from the taxing district to our regular account, and our total deposit so far for the year is $160,005.01. So our bank balance there is $544,544.03.
Okay. Anything else? Anybody have any other questions on the financial statements? Okay. Next meeting date?
Let's see, I will. Yeah, I apologize for the last one. We tentatively set for September 14th at the last one, but we always do the 3rd Tuesday, so that was my bad. So we are meeting on tonight, the 3rd Tuesday. The 3rd Tuesday for November will be the 16th. So we'll do a tentative date for that. November 16th at 7 o'clock, and we'll have to see about COVID. It might be another Zoom meeting. So.
Okay. You have anything else, Stacy?
Nope, I didn't really have anything that had to have approval, just, presenting the financial reports, and probably have some more things in November.
Okay. Anybody have any questions, comments, discussion? Again, you all are doing a great job under a very difficult situation and conditions, and I don't read Facebook much because I have to restrain myself when people attack our little health department that is doing mighty and great things. So again, kudos to you all for what you do. So if nobody has anything else, I'll hear a motion to adjourn.
Make a motion.
Second,
A second.
all in favor, say aye.
Aye.
Aye, opposed, no. Okay, thank you, everybody, for getting on.
Thanks.
Yes, thank you.